Ida slams Louisiana hospitals brimming with virus patients. Southern Louisiana's hospitals, already packed with coronavirus patients from a fourth surge of the virus, were dealing Sunday with another challenge, the howling Category 4 hurricane pounding the coast.Lady of the Sea General Hospital in Lafourche Parish, near where Ida made landfall, reported extensive roof damage. All patients and staff are fine at this time without injury, although our hospital has sustained significant damage, hospital's CEO Karen Collins said in a message relayed via Facebook. The hospital's phone system was down. Once it is safe to do so, they will evacuate their small number of patients, State Health Department spokeswoman Allie Neal said in an email. Details on the number of patients involved were not immediately available. Another Lafourche Parish hospital, Thibodaux Regional Medical Center, reported a partial generator failure to the state. Christina Stevens, a spokesperson for Governor John Bel Edwards, said the facility had not lost all critical power. She said some patients were moved to another part of the facility and the State Health Department was working with the hospital. Ida struck as hospitals and their intensive care units were filled with patients from the fourth surge of the COVID-19 pandemic, sparked by the highly contagious Delta variant and low vaccination rates across Louisiana. Daily tallies of new cases in Louisiana went from a few hundred a day through much of the spring and early summer to thousands a day by late July. Governor John Bel Edwards told the Associated Press on Sunday that more than 2,400 COVID-19 patients are in Louisiana hospitals, saying the state was in a very dangerous place with our hospitals.
The governor also said 22 nursing homes and 18 assisted living facilities have been evacuated, though evacuating the largest hospitals was not an option because there simply aren't other places to send them. Anticipating that power could be out for weeks in places, Edwards said a big focus will be on making sure there is enough generator power and water at hospitals so they can keep up with vital patient needs such as providing oxygen or powering ventilators. I hate to say it this way, but we have a lot of people on ventilators today and they don't work without electricity, he said. Officials at Ochsner Health, which runs the largest hospital network in Louisiana, said roughly 15 of the network's hospitals are in areas potentially affected by Ida. The network evacuated some patients with particular medical needs from small, rural hospitals to larger facilities. Warner Thomas, president and CEO of Ochsner Health, said Sunday that the system decided preemptively to evacuate a smaller hospital in St. Charles Parish when the storm's track shifted a bit east. He said 35 patients were moved to other hospitals in the region over a little less than 3 hours. When it comes to power at their facilities, Mike Hielfeld said, they are in pretty good shape. 3 of their facilities in areas affected by Ida were moved to generator power in anticipation of losing city power. Later Sunday, the hospital system said they plan to evacuate all patients at 2 other hospitals in the system on Monday as soon as conditions allowed. One hospital, with 21 patients in Raceland, suffered roof damage while the other facility with 45 patients in Houma had roof damage and power issues. Other facilities have suffered roof damage, water leaks and some damage to windows that required moving patients. At the hospital's main campus just outside of New Orleans, Thomas said they'd had problems with water leaks but no structural issues and had performed some surgeries Sunday. They've had no injuries reported. We'll know a lot more tomorrow morning when we have daylight, he said. Hielfeld said the hospital network ordered 10 days of supplies for facilities in areas that might be affected by Ida, and everything arrived Saturday. Each facility has backup power that was tested in a backup fuel truck on site. Many of the chain's hospitals also have water wells in case city water goes out. With people evacuating and potentially going to stay with relatives or in shelters, medical officials said they are concerned the hurricane could translate into more coronavirus infections in coming days just as hospitalization numbers are going down. Thomas said the hospital system has seen a decline in almost 200 coronavirus patients over the past week across all their facilities.
Thank you for watching. Please subscribe.